Hi, come on in. Okay, you can have a seat right there. How are you doing today? Good. My name's Nani. Welcome to the clinic. Are you a new patient or have you been here before? Okay. Do you have an appointment? Okay. Do you know the name of what provider you have that appointment with? Okay. And can you give me your first and last name, please? Can you spell that for me? Okay. And your date of birth? Alright, perfect. Let me look you up in our system real quick, okay? Okay, so it says here that we have you set for an appointment in a little bit over an hour, actually. So you're here early. That's perfectly fine, though. You can always sit here and wait. Although, let me see. You said you're a new patient, right? So it does. Okay, yeah. So it looks like I don't have any health history information for you here. Did you see a provider before coming here? Did you have a past medical provider? Okay. And did you ask them to send your information over to us, or? Okay, yeah, they weren't able to transfer it. Okay, no problem. That's totally fine. So what we might actually do, since you're here early, is that if you don't mind, you can sit here with me and we can go over your health history. So I can pull up a form and we can go through it, and that way everything can be up to date for the doctor and the nurse. Okay. Okay, so real quick before we start, just to confirm that I have the right person, can I please have an ID? Okay, perfect. Let me just take a look at that. Okay. Alright, so that seems to match what I have. Here you go, you can take that back. Okay, so let me just pull up the form. Alright, so I pulled up the form. Let's see. So we do have a lot of questions. Some of it's gonna feel probably a little personal, a little private. Just try to be as honest and as open as possible with these things, as accurate as you can be, because again, this information is gonna stay confidential. It's just for the clinic, for the providers that are gonna be working with you, but we just want to make sure that the provider and the nurse and everyone that's working with you has as up-to-date and as accurate information as possible. That way they're able to provide care for you as best as possible. You know, we want to make sure that we address any issues you have with all that background information in mind, right? Yeah, of course. So yeah, so just try to be as open as possible. If you do feel uncomfortable with any questions, you can always choose not to answer, but again, it's just so that we're able to provide as best care as possible for you, okay? Let me just take a sip of my coffee here. Alright, so let's get started. Okay, so let me just put the date for today. Okay. Alright, so we're going to start off just with some basic patient information. I know you already showed me your ID, but just one more time, can you please tell me your name, first and last name? Okay, very good. And can you tell me your birth date, please? Okay. And where were you born? Can you spell that for me? Okay, and what state was that in, or country, or? Okay. All right, and how old are you? Okay, and what is your marital status? Okay, and what's your current occupation? Okay, oh, interesting. Haven't met many people that work in that field. How long have you been working in that? Okay. All right. And how would you describe your race or ethnic origin? Okay. All right. And what's your preferred language? Is English okay? Okay, now if you do prefer a different language, I can always write it down, and if the providers that are working with you don't speak that language, we can provide an interpreter if needed. Okay, all right, and the patient is the source of information here. Okay, all right, and what's your primary reason for seeking care today? Okay, you've been having some abdominal pain. Okay, any other issues? Some constipation as well. Okay. All right, so I'll ask you a couple more questions about that in a bit. Okay, and how would you describe the history of your present illness? So when did the abdominal pain and those issues start? About 2 weeks ago. Okay, was there anything that led up to it? Okay, you think it might be related to stress and stuff? Okay. All right, so I'll ask a couple more questions about that in a bit. And how would you describe your symptoms as far as the abdominal pain and all of that? Okay. So kind of like an aching. Does it feel like it's deep? Does it radiate anywhere? Okay, just kind of your entire abdomen. Okay. Any pain when you use the bathroom? Anything like that? Okay, moving on. We're gonna go over your past health history. So I'm gonna list a couple of things, and I want you to just let me know if you've had these illnesses before, okay? All right, so starting with measles, okay, mumps, okay, rubella, chickenpox, pertussis, whooping cough, okay, strep throat. Okay, and how old were you when you had that, or what year was it? Okay. All right. Polio. Okay, rheumatic fever, scarlet fever. Okay, COVID-19. Okay, and when did you have that? Okay. Right. Any other prior illnesses of mention? Okay. That's fine. If you think of anything later on, you can always just let me know again and I can add it, okay? Yep. Okay. Any history of accidents or injuries? Okay. Fell off your bike when you were a kid. How old were you? Okay. And was there any extensive injuries there? Any concussions? Any broken bones? Anything like that? No. Okay. Okay. All right. Moving on to serious or chronic illnesses. So again, I'm going to list a couple of things and I just want you to let me know if you have any of these, okay? All right. Diabetes, heart disease, respiratory disease, mental health disorders. Okay, you have anxiety. Okay. And is that a diagnosis of an anxiety disorder or just anxiety symptoms? Okay, just the symptoms. Have you ever been evaluated for anxiety to see if you had any anxiety disorders? You have not. Okay. Is that something you'd be interested in? I could maybe put in a note and we can see if we can get you a referral. Okay, because you said that you think that your abdominal pain and stuff gets worse when you're stressed and anxious and stuff. So, okay. Okay. All right. Sickle cell anemia. Okay. Cancer. Any immune disorders? Hepatitis? Seizures? Okay. Any other conditions? High blood pressure. Okay. Yeah. So that technically can go on here. Hypertension. Okay, now is your blood pressure managed? When was the last time you had your blood pressure checked? Okay, it's been a few years. Okay. Okay, so you don't know what it currently is, right? Like what it tends to be. Okay, do you take any medication for it? No, okay. All right, so that's definitely something that we can have the provider look at during your checkup today, okay? Yeah. Definitely we want to make sure that the hypertension, the blood pressure is managed under control. We don't want anything, any side effects of having high blood pressure to happen, okay? Yeah, okay, so I'll make a note of that. Anything else? Okay, yeah. All right, any history of hospitalizations? Okay. Okay. Any history of surgeries, including any dental surgery procedures? Okay. So, let's see. When was your last physical exam, if you remember? Okay. Yeah, so 3 years ago. Okay. And what was the name of that physician that you had? Okay. And what facility was that? What clinic? Okay. And where was that? Okay. Do you have a dentist currently? No. Okay. Yeah, so we can also try to get you a referral for a dentist if that's something that you would want. We definitely recommend it. Yeah. Okay. Yeah, we can see try to find someone that you can be referred to that's covered by your insurance. Yeah. Okay. So I'm going to ask you about your current medications. This includes anything that was prescribed to you, anything that you take over the counter, or any herbal medications as well, so supplements, things like that. Yeah, we ask about supplements as well because even though they're not prescribed necessarily, sometimes they can have interactions with the medications that are prescribed to you, so we don't want there to be any adverse effects there. That way, if let's say your blood pressure is elevated or something and the doctor needs to prescribe something for that, we want to make sure that we're not giving anything that conflicts with what you might be taking. And we also want to know what you might be taking that could maybe be causing that elevated blood pressure, things like that. Yeah, so okay, so do you take any prescribed medications? No. Okay, any over-the-counter medications, anything like for allergies, things like that? Okay, you do take allergy medicine. Okay. What medication do you take for that? Do you know? Claritin. Okay. Do you know what the dosage is by chance? Okay, you're not sure. How many pills do you take a day, like of the Claritin? Okay, 1 per day. And at what time do you usually take that? In the morning. Okay. And what's that for? I know obviously allergies, but what kind of allergies do you? Just seasonal? Okay, and also pets, like cats and dogs and stuff? Okay. And any other over-the-counter? Have you been taking anything for the abdominal pain, anything like that? Yeah, you've been taking ibuprofen. Do you know how much you've been taking? Okay, 1 or 2 pills. You don't know the dosage though, right? Okay. And that's for pain management, you said? Yeah, okay. Okay. And how long have you been taking that for? Okay, just for the past week. Okay. Going back to the allergies, like how long have you been taking allergy medications for? I know you said you take them every morning. Okay, this is like, yeah, every spring, and okay. Yep. For how many years have you been taking that, do you know? Okay, I'm not entirely sure. That's perfectly fine. Okay. So, let's see. Do you take any herbals, any supplements, anything like that? Yeah, so like for example, some people will take like fish oil supplements or maybe like turmeric, like things like that. Okay, nothing that you can think of. Okay, so no herbals. All right. Now, as far as allergies, you said that your only allergies are the pollen, the seasonal, and the cat and dog dander. Okay, any allergies to any medications, any foods, anything like that? Okay. As far as your allergies to pollen and to cat and dog dander, how would you describe your reaction whenever you're having a... Okay, mostly just sneezing, sniffling. Okay, sneezing, sniffling. Do you have any, like any itching, any trouble breathing, any redness? No, okay, cool. So you wouldn't say the reactions are anything like extreme? Okay. All right, and have you ever had any allergic reaction that required the use of epinephrine, so an EpiPen, or hospitalization? No. Okay, just checking the time here real quick. Okay, very good. So let's move on to family history. So I'm going to go over a list of things, list of conditions, and if you have a family member that has had these, just let me know what family member it is, what their relation is to you. Now, this should be just immediate family members, so if it's like an aunt or something like that, there's usually no need to mention it. We're mostly looking more for like a parent, a sibling, grandparent, things like that, okay? Yeah, so, okay, so starting off, we've got heart disease, any history of heart disease? Okay, is that on your mom's side or your dad's side? Okay, so maternal grandmother. Okay, hypertension. Okay, and that's both. Okay, both parents. Okay, any history of stroke in the family? Okay, any diabetes? Okay, okay, grandfather on the dad's side. Okay, any blood disorders? Okay, any breast or ovarian cancer? Okay, any other cancers? Okay, any history of sickle cell anemia? Okay, any arthritis? All right, allergies? Okay, your sibling. Okay. All right, any history of asthma? Okay. Obesity? Okay, both grandparents. Okay. Any history of alcoholism or drug abuse? Okay. Any history of mental illnesses? Any history of suicide? Any seizure disorders? Okay. Kidney disease? Okay. And tuberculosis. All right. Now I'm going to ask some questions about your parents, your birth parents. Your mother, where was your mother born? Okay. And is she currently alive? Okay. And your father, where was he born? Okay. And is he currently alive? Okay. And you mentioned you have siblings. How many siblings do you have? Okay. And are they alive? Okay. And are they older or younger than you? Okay, 2 older, 1 younger. Okay. All right, so now we're going to do a review of systems. So this is going to be the bulk of this questionnaire, because we're going to go over all of the different systems of your body, organ systems and things like that. And I'm just going to ask you a list of conditions for each of those systems or symptoms that you might have, and I want you to let me know if you have experienced any of them currently or in the past. And then I might ask you a couple more questions to kind of expand on that, okay? Yeah. Before we get to that though, we're going to just do some questions about your general health, okay? Yep. So how would you describe your general overall health in your own words? Okay. What do you mean by that? Okay. What's your current weight, if you know? Okay, you're not sure. That's okay. When you go in for your appointment, they will take your weight, so you'll have an updated number on that. Do you remember what your weight was the last time that you got it checked? Okay. And as far as you're aware, have you had any recent weight gain or weight loss? Okay, I'm not sure. That's fine. Okay. And then overall, have you had any feelings of fatigue, weakness, fever, chills, sweats, night sweats, or malaise? Malaise meaning like just feeling unwell in general. Okay. And you say that's related to that abdominal pain you've been having? Okay. Okay. All right, so moving on to the systems. So we're going to start with the head, right? Do you have or have you had any headaches, head injuries, dizziness, or vertigo? So like a sensation like you're spinning. Okay, some headaches sometimes. Okay, what would you say spurs those headaches on? Okay, bright lights, loud noises. Okay. How often do these happen? Okay, only like once every couple months. Okay, and how would you describe these headaches? Is it like a pounding, just an overall ache? Does it focus on any specific part of your head? Okay, just overall ache, kind of like a pounding. Okay. Do you find that there's anything that helps with those headaches to decrease your symptoms? Okay, just laying down for a bit. Okay. So I'm making note of that. The doctor might ask you a couple more questions about that when you go in, okay? Sometimes one of the things that we might worry about with high blood pressure could be that it affects, well, it can affect a lot of things if it's unmanaged, but it can cause things like headaches and stuff. So we want to just make sure that there's no relation between the two, no correlation there. Because again, it can put you at risk for things such as strokes and things like that. So the provider will definitely want to go over that with you. Yeah, but you said it's only once every couple of months, so hopefully it's not anything that's of great concern. Yeah. Okay. So let's move on to the eyes. Do you have any history of blindness, decreased visual acuity, any blurring, blind spots, eye pain, double vision, redness, swelling, watering, discharge, glaucoma, or cataracts? Okay, just some redness with the allergies. Okay, yep. Okay, and then for the ears, have you experienced any hearing loss, any earaches, infections, discharge, tympanic membrane perforation, any tinnitus, that's ringing in the ears, any vertigo, or well, vertigo is the spinning sensation again? Okay, nothing that you've noted. Good. As far as the nose and the sinuses, have you noticed any discharge, any history of polyps, any frequent colds, sinus pain, sinus infections, obstructions, nosebleeds, allergies, hay fever, or changes in your sense of smell? Just the allergies. Okay, and you did go over those earlier. Did you say that you find that the medication you take for it, does it help usually? Okay. Good. Okay, and then for the mouth and throat, do you have any mouth pain, any sore throats, bleeding gums, toothaches, mouth or tongue lesions, any difficulty swallowing, hoarseness, voice changes, tonsillectomies, or altered taste? You had some altered taste back when you had COVID. Okay. Do you find that your taste has come back to normal, or? Okay, so it's back to normal. Okay. Okay. All right, and then moving on to your neck, have you noticed any pain, any limitation in movement? So when you try to move your head from side to side, things like that. Any lumps, any swelling, any enlarged or tender nodes, or goiter, which is when your thyroid, like this area here, is kind of enlarged. Okay. No. All right. Okay, and then moving on to the breasts, have you noticed any pain, any lumps, any nipple discharge, rash, history of breast disease or surgery? Okay, and have you noticed any tenderness around the armpits, any lumps, any swelling, any rashes? Okay. All right. Do you have a history of skin disease, such as eczema, psoriasis, hives, any pigment or color changes, any changes in any moles, any excessive dryness or moisture, any pruritus, which is like itchiness, any bruising, any rashes or lesions? Okay, so some dryness. Okay, where did you say that dryness tends to be? Okay, on your hands. And is that all the time or every now and then? Okay, usually around the winter. Okay. Do you find that you have any issues with that dryness? Any discomfort? Any... Okay. And do you do anything for it? Just put lotion stuff. Okay. Yeah. Do you find that the lotion helps? Okay. All right. Now with your hair, any recent hair loss, any changes in hair texture? Okay. With your nails, any brittleness, any splitting, pitting, fungus, any changes in shape or color? Okay. All right. Moving on to the respiratory system. Do you have any history of lung disease, any asthma, emphysema, bronchitis, pneumonia, tuberculosis, pain with breathing, any wheezing, shortness of breath, cough, sputum, so like kind of like lots of phlegm and stuff? Okay, any history of coughing up blood? Okay, and do you have any exposure to pollution or toxins that you're aware of? Okay. All right. Okay, moving on to the cardiovascular system. Any chest pain? Any pressure or tightness? Any fullness in the chest? Okay, any palpitations or fluttering in your chest? Okay, any cyanosis, so that's when your skin is kind of bluish or purplish. Okay, any difficulty breathing on exertion, so maybe when you're walking, anything like that? Okay, any orthopnea, so that's when you're lying down and you get short of breath? Okay, any so there's something called paroxysmal nocturnal dyspnea, so that's whenever you're laying down trying to go to sleep and you wake up because you have shortness of breath and coughing. Okay, nothing like that. Okay, any nocturia, so having to get up at night to go to the bathroom to pee? Okay, any edema, that's like swelling and stuff? Okay, any history of heart murmurs? Okay, history of coronary disease? Okay, any anemia? All right, and the hypertension. Now you mentioned that you were hypertensive the last time that you went to a doctor's checkup. That was 3 years ago. Okay. And you said that you haven't been monitoring your blood pressure, right? Okay. Did they give you any medications at the time for that high blood pressure? Okay, so they did. What medication was it? Do you know? Okay, something that ended in lol. Okay, yep. Yeah, and did you find that it helped at all, or you weren't really sure? Okay, yeah. And you said that you're not taking anything right now for it, right? Okay. Okay. All right, so we made note of that. With your high blood pressure, again, like I said, sometimes it can cause things like headaches or blurry vision, things like that. Have you experienced anything like that? Anything that feels abnormal with? Okay. Yep. Okay. So let's see. Moving on to the peripheral vascular system. So this is going to be like your hands and your feet and things like that. Do you notice any coldness, any numbness, any tingling, any swelling of your legs? Any discoloration of your hands or feet? Okay, any varicose veins? Okay, any cramping or muscle pain with exertion? Okay, any blood clots? And what about any leg ulcers? Okay. Okay, and then gastrointestinal. So do you have any food intolerance? Any difficulty swallowing? Any indigestion? Okay, any burping? Yeah, I mean, burping's normal, right? We want people to burp, that's healthy. But I guess any issues with the burping, like do you notice that you've been burping more than usual, or does it cause discomfort, anything like that? Okay, yeah. Any flatulence? So like farting, yeah. Yeah, okay, yeah, no, that's also normal. We do expect, obviously, people to fart. That's part of what our bodies do. Perfectly normal and the sign of a healthy body, usually. Yeah, but just, you know, if you noticed any increase in it, or any issues like maybe like abdominal distension, like you feel bloated or anything like that, then that would be like something to note. Not really. Okay, yeah. Abdominal pain, I know you said that. So I'm going to ask a couple questions about your abdominal pain. So you said that it's been going on for about 2 weeks? Okay, and you said that it seems to be stronger when you're feeling anxious, or okay. And where do you feel that? Does it spread anywhere, or is it concentrated in one area of your abdomen? Okay. Okay, so it's through the whole thing. Okay. And do you find that anything helps with it? I know you mentioned taking ibuprofen. Okay, and that helps a bit. How would you say your pain is with that abdominal pain? On a scale of 0 to 10, where 10 is the worst pain of your life, or worst pain imaginable, how would you rate it, usually? Okay, like a 6. Okay, and is it usually about a 6? Yeah, usually a 5 to 6. Okay, and when you take that ibuprofen, does it help lower that pain level at all? A bit. Okay. To like what rating would you say on? Okay, just to like a 4. Okay. Okay. Yep, so we're definitely going to make note of that for the provider, and they're going to ask you more questions about that. They'll do a more thorough examination of your abdomen and try to see what might be going on there, okay? Yep. Okay, so as far as your gastrointestinal system, we have a couple more questions to go over, okay? So have you had any heartburn, any nausea, vomiting blood, okay? Any history of liver or gallbladder issues or disease, okay? Any gastric or duodenal ulcers, okay? Any jaundice, appendicitis, colitis, any constipation or diarrhea? Okay, some constipation. Okay, and when did that constipation start? Has that been an ongoing issue? Okay, about 2 weeks ago, 2 or 3 weeks ago. So around the same time as the abdominal pain. Okay, so maybe they might be related. That's definitely something to mention to the provider. Would you say that anything kind of spurred that constipation? Was there anything that kind of led up to it that you know of? You're not really sure. Okay. All right. Have you been taking anything for the constipation? Okay, so you do take some stool softeners. Do you find that helps at all? Okay, it helps a bit. How often have you been having bowel movements? Okay, like once every 2 days. Okay. All right. Okay. And you said no diarrhea, just the constipation. Okay. Any black or tarry stools? Okay. Any rectal bleeding? Any hemorrhoids? Okay. Any rectal fistulas? Okay. How's your appetite been? Okay, a little bit diminished. And would you say that's a recent change? Okay. Yeah. When did your appetite start changing? Okay, over the past week. And would you say that's related to your abdominal pain? Okay. So because of the pain, you've been kind of eating a little bit less, haven't been as hungry. Okay. Okay, and when was the date of your last bowel movement? 2 days ago. Okay. Okay, 2 days ago. And you said you've been having them about every 2 or 3 days. Okay. Okay. The last bowel movement that you had, how would you describe the stool? Was it normal for you? Was it a little bit different in terms of the color, the consistency? Okay, so it was brown, so that's normal. That's good. At least there's not any obvious like blood or anything. Okay, and consistency? Okay, kind of hard. Okay, so did it hurt to go to the bathroom? Like, okay. Okay. And you said that's been a recent change in your bowel movements, right? Had you had any changes in your appetite or anything, or what you were eating, consuming, leading up to when these issues started? Okay, not that you know of. So moving on to the urinary system, do you experience any frequency with urination? Like you have to go pee a lot very often? Okay. Any urgency? Okay. Any urination at night? Okay. Any pain with urination? Okay. Do you notice that you pee excessively, like a large volume every time? Okay. Any low volume of urine? Okay. Do you have any hesitancy when urinating? Any straining? Any narrowed stream of urine? Okay. Any incontinence with urinating? So like you feel like you are unable to control your bladder, you might maybe have an accident. Okay, nothing like that. Any history of kidney disease? Any history of kidney stones? Okay. Any history of UTIs? Okay, just once in the past. Okay, and how old were you when you had that? Okay. And how did that present? Any symptoms with, okay, like burning? Okay, and I'm assuming it was treated and, okay, yep. With antibiotics or, okay. And after that you haven't had any issues with the urination? Okay. Okay, any history of flank pain, any issues with groin pain, suprapubic pain, or lower back pain? Okay. How frequently do you urinate? Okay, 3 to 4 times a day. How would you describe the color of it? Okay, like a clear yellow. Okay. Any abnormal characteristics, like is it cloudy at all, dark, bloody, etc.? Okay. Have you noticed any recent changes in the color or the characteristics? Okay, no. All right. Okay, now moving on to the genital system. Do you have any pain before your periods? Any pain with your periods? Okay, just some cramping. Okay, any spotting in between periods? Okay, any itching, abnormal discharge? Okay. When was the date of your last menstrual period? Yeah, that's fine. I use an app to track it sometimes too. Okay, yep. How frequently do you have your periods? So it's a little bit abnormal, would you say? Yeah, like every other month. Okay. Okay, and how long do they usually last? Okay, yeah, so a little bit long. Okay. As far as the frequency, you'd say that they're like regularly irregular? Yeah, okay. Do you see a gynecologist at all? Okay, you haven't in a while. Yep, so we can definitely also put in a referral for that if you want, or if you'd like, sometimes our providers here are able to do gynecological exams. Yeah, yep. Okay, and how old were you when you got your first period? Okay. So in terms of sexual health, do you experience any pain with sexual intercourse? Okay. Have you had a history of gonorrhea, herpes, chlamydia, any warts, syphilis, HIV or AIDS? Okay. Do you have contact with anyone who has sexually transmitted infections? Okay. Are you presently in a relationship involving sexual activity? Okay. Do you use any contraception or protection? Okay, and what method do you use? Okay. Any issues there with anything? Alright. So, moving on to the musculoskeletal system. Do you have a history of arthritis, gout, joint pain, stiffness, swelling, any deformities. Okay, any limitations in movement, any noise with moving your joints. Okay, any muscle pain or cramps. Okay, any weakness. Okay, do you have any issues with walking or coordinating your movements? All right, any history of back pain or disc disease? Okay. Neurological stuff, so do you have any history of seizures or seizure disorder? Okay, any history of stroke or fainting? Okay, any dizziness or blackouts? Okay, any weakness? Any tics or tremors? Okay, any paralysis, numbness, tingling? No, okay. Any memory or cognitive disorders? Okay, do you ever feel disoriented? Okay, nervousness, anxiety. I know you mentioned anxiety earlier. Yeah. Okay. Any mood changes? Okay, any depression? No depressive symptoms, okay. Any coping problems? Okay, any hallucinations? All right. So moving on to the hematological system. So this is everything with blood. Do you have any bleeding disorders? Any excessive bleeding? Okay. Any excessive bruising? All right. Any swelling of the lymph nodes? Okay. Any history of leukemia? Any exposure to toxins or radiation that you're aware of? Okay. And have you had any blood transfusions in the past? Okay. All right. Endocrine system. So do you have any history of diabetes? All right. Do you have any of the following diabetic symptoms? Urinating a lot? Eating a lot or wanting to eat a lot? Okay. And being very thirsty, wanting to drink a lot of fluids. Okay. Any history of thyroid disease? Okay. Any intolerance to heat or to cold? All right. Have you noticed any changes in your skin pigmentation or color? Any excessive sweating? Okay. Any abnormal hair distribution? Any nervousness or tremors? Okay. And have you ever been on hormone therapy? Okay. All right. So moving on to our next section, we've got some questions about health promotion. So what things do you say that you do to promote good health for yourself? Okay. So you go on walks. How often do you go on walks? Okay, 3 or 4 times a week. That's good. Anything else? Like anything maybe with like eating habits, anything like that? Not really. Okay, that's perfectly fine. Do you wear glasses or contact lenses? Yeah. Okay, I can see those on you. How long have you been wearing those for? Okay, so let's see. Okay. Do you have any conditions involving your eyes? Okay. When was the date of your last vision exam or glaucoma exam? Okay, can't remember. That's okay. We're gonna do part of the visual exam here with your provider. So, yep. And if needed, they might refer you to a specialist. Yeah. And when was the date of your last hearing exam? Okay, also can't remember. That's perfectly fine as well. They can do that here. Have you experienced any hearing loss? Okay, and do you use hearing aids? Okay. Do you have any exposure to environmental noises? So this is stuff like any loud noises such as construction, if you live near any sites that have very loud noises, if you live next to like a highway that's really busy, things like that. Okay. Do you brush and floss your teeth? Yeah. Okay, and how often would you say you do that? Okay. Do you have any dental prosthetics, such as dentures, partials, bridges? Okay. How often do you get dental checkups? Okay. Not very often. That's fine. Yeah, so we definitely recommend getting dental checkups at least twice a year. If you need some referrals or maybe some suggestions of places that you could go that are covered by your insurance, we can definitely see if we can get you some information on some places that you could go do that, okay? Okay. Do you perform breast self-exams? Yes. How often do you do that? Okay, once a month. Good. What is your method for performing breast self-exams? Okay, just kind of feeling around. Okay. Okay. Have you had a mammogram before? And if so, when was the last one? Okay. All right. Have you had a tuberculosis test before? Okay. Do you smoke cigarettes? Do you smoke cigars or pipes? Okay. Do you vape? Okay, how often do you do that? Okay. When did you start vaping? Okay. And okay, so mostly just at social. Okay. All right. Do you chew tobacco? Okay. Okay, and have you ever tried to quit vaping? Okay. Have you ever had an EKG done? No? Okay. All right, so that is something that potentially we might have to do if the provider and the nurse check your blood pressure and it's very elevated. Sometimes they like to do an EKG just to make sure your heart rhythms are normal and that there's no issues there. But if you do have to do it, you know, they'll walk you through it over there in the office. Yeah, but it's usually, you know, it's a painless procedure, so yeah. Okay. When was the last time you got blood work done, if you remember? Okay, about 3 years ago for your last appointment. Okay. Do you remember if there were any abnormal results? Can't remember. Okay. Yep, so we definitely want to get some blood work done. The provider will probably write an order for you, and you know, you can go get your blood work done, and then they'll have you come for a follow-up appointment to go over the results. Okay. Okay. Alright, usually we do want to do blood work at least once a year for your annual, yeah. Okay, and have you done any other tests, such as for STDs, STIs, anything for HIV, syphilis, gonorrhea, chlamydia? Okay, haven't had any of those. Alright, and are you up to date on your vaccinations or immunizations? Okay. Do you use any antacids? Okay, any laxatives? I know you mentioned stool softeners for the constipation. Okay, do you know what brand of... You're not sure, okay. Okay, and do you find that that helps with the constipation? Okay. Have you had a colonoscopy before? Okay. When was your last gynecologist exam? Okay, also a couple years ago. Okay. Do you remember when your last pap test was, the pap smear? Okay, not sure. And you're not sure about the results either, right? Okay. So that's another thing we'll definitely want to get you up to date on, you know, just to check for any presence of any abnormal cells. Yeah, so again, we can see if we can talk to the provider about either having someone do that for you here or getting you set up with a referral for a gynecologist elsewhere. Yeah. When you use the bathroom, when you urinate and when you have a bowel movement, do you wipe from front to back to avoid UTIs? Okay, very good. Do you drink alcohol? Okay, what kind do you drink? Okay, when was the date of your last drink? I don't remember. Do you know, like, approximately how long ago? Okay, about a month ago. How much did you drink on that occasion? Okay, 2 to 3 beers. Okay, how much do you usually drink? Okay, and how often would you say you do that? Okay, just once in a while. Okay, yeah, it's social events. Would you say that this affects your work or your family in any way? Any effects on relationships? Okay. Okay, now for a quick screening here. Have you ever thought you should cut down on drinking? Have you ever been annoyed by criticism of your drinking? Okay. Do you ever feel guilty about your drinking? Okay. Do you drink in the morning as the first thing you do when you wake up? Okay. Do you use any illicit or street drugs? Okay. Any use of opioids, cocaine, crack, amphetamines, heroin, marijuana, Molly, ecstasy, PCP, LSD? Okay. Have you ever been in treatment for drugs or alcohol? Okay. Do you use seatbelts when you're in the car? Okay. Are there any workplace hazards at your workplace? Not that you know of. Okay. Have you traveled abroad in the last 30 days? Okay. Have you experienced any emotional, physical, or financial abuse from your partner? Okay. Have you ever been forced to have sex? Okay. Do you feel safe in your home? All right. Now for the functional assessment, this is just some questions about your activities of daily living, so what you do on your day-to-day life. Okay. So first, I'm just going to ask about your education. What was the last grade that you completed, or your last degree? Okay. And what was that in? Okay. Oh yeah, so that's like related to your work probably. Yeah. Okay. And do you have any other training? Okay, is that a certification? Yeah. Okay. Would you say that your financial status, your income, is sufficient for your lifestyle needs and or health concerns? Okay. You mentioned that you go on walks 3 or 4 times a week. Is that the only physical activity or exercise that you do? Okay. Okay. And how do you tolerate that activity? Do you find that you get tired easily, or? Okay, tolerate it pretty well. When you do walk, how much walking do you do per day, would you say? Okay. 45 minutes to an hour. Okay. Do you use any mobility aids? Okay. And what activities do you do for leisure or for enjoyment? Okay. Oh, that's fun. Okay. For sleep and rest, when do you normally go to sleep? Just a range is fine. Okay. And how long do you normally sleep for? How many hours? Okay. Do you take naps during the day? Okay. And do you use any sleep aids? Okay. Do you drink any caffeine? So anything in coffee or any caffeinated drinks, like energy drinks, things like that? Okay. And how much do you drink per day? Do you know? I'm not sure of how much exactly. I guess you said you drink like energy drinks. How many do you usually drink per day? Like how many cans or how many? Okay. Okay, so that's another thing that the provider might ask you a little bit about, because sometimes when we have too much caffeine, that can elevate blood pressure. Yeah, so it's something to consider. Yeah. Okay, now I'm going to ask you to recall what you ate and drank over the past 24 hours. Okay, I know you said you haven't been eating as much due to the abdominal pain, so yeah, so what did you have for breakfast? Okay. What about lunch? Okay, no lunch. Any drinks? Okay, just an energy drink. All right. And then what about for dinner? Okay. Okay. And any like desserts, anything like that? Any snacks? Okay, not really. Okay. And would you say this is your typical diet? Okay, yes, but a little bit. You usually eat more than this? Yeah. Okay. Would you say that your income is sufficient for the food that you buy? Okay, and who prepares the food at home? Okay. How would you describe your role in your family? Okay. How do you get along with family, friends, or coworkers? Okay. Would you say that you have a support system? Okay. And who do you go to for help or advice with problems? All right. Yep. Do you ever spend time alone? How much would you say that you spend alone? Okay, and how often? Okay, do you find that alone time pleasurable or isolating? Okay, yeah, no, I get that. Okay, and then I'm going to ask you some questions about culture and spirituality. Would you say that faith, religion, and spirituality are important in your life? Okay, are you part of any faith, religious, or spiritual communities? Okay, are there any religious or spiritual practices that are important to you? Okay, yeah, that's every week. Okay, are there any other cultural practices that are important to you? Okay, describe any sources of stress in your life right now. I know you said that you've been having like anxiety and stress and okay, yeah, so from work. Okay, yeah. Okay, and are there any methods that you use to relieve stress? Okay, good. And then okay, and then as far as your environment, what type of housing or neighborhood do you live in? Okay, do you feel safe where you live? Okay, and do you live alone? Okay, who do you live with? Okay. Would you say that your home has adequate heating, cooling, and utilities? Okay, do you have access to transportation? And what type of transportation do you have? Okay, and is that your own or? Okay. All right. Finally, we're just going to ask some questions about your perception of health, okay? It's only a couple, and then we'll be done. How do you define good health? Okay. What are your concerns at this moment? Okay. And what are your health goals right now? Okay. What do you want, need, or expect from the nurse or other healthcare providers that are going to be working with you today? Okay, very good. All right, thank you so much. So that concludes our health history form. I know it was very long, but again, thank you for being thorough with your answers and for being honest with everything. A lot of this is going to be very helpful with providing care for you and making sure that our provider has all the information needed to make sure that they're taking care of you as best as possible, okay? Yeah, and we finished right on time. Your appointment's about to start, actually, so if you want, you can go ahead and let me just make sure that everything is submitted here, and I'll forward this to the provider and upload it to your chart. Okay. All right. And okay, so everything's on there. So you can actually go ahead. The nurse will come out in a second and we'll take you to your room, okay? So that way you can get your vitals checked and all of that. Yep. Yep, and if you need any follow-up or anything like that, the provider will let you know, and then you can come and get all that sorted out here at the front desk later, okay? Yep, of course. Thank you so much for being here, and thank you for your cooperation with filling out the forms. All right, see you in a bit.